Welcome to this video. This is going to be a short video in which we are going to discuss rosacea, and the main aim of this video is going to be to clear up any confusion between rosacea, flushing, blushing, and acne. So let's begin by discussing what rosacea is. So rosacea is the name that we give to the condition where an individual has persistent facial redness that is not explained by a systemic medical condition that individual has. So it's unexplained persistent facial redness. And rosacea as a condition is not well understood. We do not understand why these individuals have persistent facial redness. It is a condition that is most often seen in Caucasians, and it can be either focal or it can be generalized. In focal rosacea, only a small part of the face is affected, classically the cheeks, whilst the rest of the face is spared. In contrast, in generalized rosacea, the entire face is affected by the redness. And by persistent facial redness, I mean that this condition can go on for a very, very long time. It can go on for months, years, maybe even an entire lifetime. So that's what rosacea is. Now let's talk about what flushing and blushing are. So the main difference between flushing and blushing and rosacea is that flushing and blushing are transient, temporary facial rednesses that will reverse. Let's start with blushing. So blushing is the condition where the face turns red, and again it can be either focal or generalized. So focal will be it just affects a small portion of the face, usually the cheeks, whereas generalized would be it affects the entire face. And it occurs in response to emotional stress, usually embarrassment. So in an individual who blushes, when they are put in an embarrassing situation, that is going to be the usual trigger for the blushing to occur. Their face will turn red either in a focal pattern or in a generalized pattern, but importantly, it is transient, temporary, and once the emotional stress is removed, it will then get better. The redness will go away. That's in contrast to rosacea, where it just is persistent, it stays there all the time. And by the way, individuals with rosacea, they can have flushing and blushing on top of the rosacea, as well as having the background level of facial redness. But once the flushing and blushing goes away, they will obviously still maintain that background redness that is the actual rosacea. So that's what blushing is, facial redness in response to an emotional stress. What is the difference between blushing and flushing? Well, flushing is temporary facial redness in response to a physiological stress rather than a psychological or emotional stress. So let me give you some examples of where an individual who flushes might flush. So if an individual who flushes goes on a jog, that could be a trigger for flushing. So this individual does some exercise, some strenuous exercise, and their face turns red, either in a focal or generalized pattern again. That is an example of flushing. They have been exposed to the physiological stress that is the strenuous exercise, and their face as a consequence has turned red. Again, it is temporary after a few minutes of cooling down, so where the exercise is stopped, the facial redness will improve. So that's an example of flushing. Another example of flushing, there are lots of different triggers for flushing in people who do flush. Another example of flushing would be if someone goes on holiday somewhere very, very hot and the temperatures are then much higher, that might trigger flushing. But again, once the physiological stress is removed, so when they're brought back to England, the colder country, the flushing will then go away. So again, it's reversible, it's just temporary. However, the main differences between blushing and flushing is that whilst blushing generally will only last for a few minutes, flushing can last for longer periods of time, maybe even days, weeks, potentially if the trigger is still present. However, importantly, it is reversible, and once the trigger is removed, the flushing will go away, and that's the main difference between that and rosacea. So, more examples of physiological stresses that can cause flushing. When someone gets sunburnt, so let's go back to our individual who's gone somewhere hot on holiday. If they go to the beach, don't use sun cream, fall asleep on the beach, and get a lot of sun exposure, they will burn, and in response to that sun damage to the skin, you will get flushing. And again, that is a transient flushing, and it will go away once the skin has healed and the exposure to the sun is no longer present. Finally, there are some other triggers that I'd like to talk about for flushing. Certain systemic diseases can cause facial redness, and that facial redness that is a consequence of systemic disease would be called flushing rather than rosacea. So, for example, hyperthyroidism, which is a condition where the thyroid gland in the neck secretes too much thyroid hormone into the blood, this can result in facial flushing. Just a little bit of the background physiology. Thyroid hormone controls your basal metabolic rate. It controls how fast all of the cells in your body are metabolizing. If you are hyperthyroid, i.e. you have an overactive thyroid gland and too high thyroid hormone levels in your blood, all your cells go into overdrive. They start metabolizing at far too higher rates. This leads to your body creating far too much heat because metabolic reactions produce heat as waste energy. So people with hyperthyroidism, classically, they end up feeling really hot all the time. Even when they're in a really cold environment, they're really, really hot. They end up sweating a huge amount because of how hot they're feeling. They end up flushed because they're feeling so hot. Remember, the body's reaction to trying to get rid of heat is to flush the facial blood vessels so that the blood can come up to the skin and transfer the heat out to the environment. And indeed, that's the physiological basis for why you flush in response to exercise and in response to being in a hot place. Because in exercise, you're generating a lot of heat in your muscles, and when you're in a hot place, obviously you're exposed to a lot of heat. But people with hyperthyroidism, because their basal metabolic rate is increased because of the elevated levels of thyroid hormone, they end up hot all the time, and therefore they can end up with facial flushing that is going to be present until the point that their hyperthyroidism is treated and under control. So that's why it's very important that I said initially, when I gave you the definition of rosacea, that it is persistent facial redness that cannot be explained by a systemic medical condition that individual has. Because if someone has a red face because they are hyperthyroid, that is not rosacea, that is flushing because of the hyperthyroidism. Okay, and there are other systemic medical conditions that can also result in facial flushing, rarer ones than hyperthyroidism, so I'm not going to go into them, but be aware that if you have some larger scale medical condition that is causing the facial flushing, facial redness, then that is considered facial flushing rather than rosacea. So to go over what we've said so far, rosacea is persistent or chronic facial redness that cannot be explained by another medical condition. If another medical condition is causing the redness, then that is flushing because it is a physiological stress that is occurring rather than rosacea. So rosacea, if you want to use a fancy word, is idiopathic, meaning that we cannot find an explanation for it, facial redness that goes on for a very long period of time. Meanwhile, blushing, in contrast to flushing, is the facial redness that occurs in response to emotional stress. So blushing and flushing are both transient, temporary, reversible. Rosacea is this idiopathic condition. We can't find an explanation for it that goes on and on and on, and we are not very good at treating it at present. So that's hopefully cleared up any confusion that you might have between rosacea, flushing and blushing. To end the video now, I just want to talk about rosacea and acne, because these two conditions can get confused, and there are two reasons that these conditions can get confused. The first is a bad reason. So the first reason that rosacea and acne get confused is that rosacea had an old name, and its old name was acne rosacea. So I'll say that again. We used to call rosacea acne rosacea. Meanwhile, the full name for acne, spots, was acne vulgaris. And the reason that rosacea used to be called acne rosacea, paralleling acne vulgaris, is because these two conditions used to be thought to be related. So the old thinking was that these two conditions were actually related and shared some sort of pathological basis. That trail of thought has now died. We no longer believe that these two conditions are related, and therefore we have stopped calling rosacea acne rosacea. So you should not call rosacea acne rosacea, you should just call it rosacea now. And you can still call acne acne vulgaris if you like, that's its full name, but when someone says acne, you should not think rosacea, you should think spots, whereas rosacea is redness. So that was the first reason that people get rosacea and acne confused, because their names used to be similar. The second reason is a better reason, and that is that often these two conditions can coexist. So often people can have rosacea and they can have acne as well. To confuse the matter, there is then a condition called papulopustular rosacea that I'm going to just type down for you, because this is important, so I'll write it here. So there is this condition called papulopustular rosacea. There we go. And this is a condition where people get spots because of their rosacea. So it's not that they have coexistent acne and rosacea, it's that they have purely rosacea, but that the rosacea is bad enough to actually cause spots. Papulopustular rosacea. So remember, papules are raised inflammatory spots. Pustules are also spots, but they're the spots that contain a lot of pus. Now, let me clarify this for you. I want to make it quite clear when it is appropriate for someone to be diagnosed with papulopustular rosacea and when it is appropriate for someone to be diagnosed with rosacea and acne coexisting. So let me give you some different scenarios. So let's say we have an individual who has generalized rosacea, so their face is red, and they also have spots, and they have spots on their face, and they have spots also on their chest and their shoulders. That is an example of an individual who has coexistent acne and rosacea. And the way that you can tell that that is coexistent acne and rosacea rather than papulopustular rosacea is that they have the spots also going onto their shoulders and their chest that is not affected by the rosacea. So the spots go beyond the area that is affected by the redness of the rosacea. In contrast, let's say we now have an individual who has focal rosacea of the cheeks, and then they also have spots, but the spots are limited completely and utterly to those areas of the cheeks that are affected by the redness. So beyond those areas, so on their forehead, on their chin, on their nose, they don't have any spots, and they've never had a spot in those positions. That is an example of papulopustular rosacea, where the spots are completely and utterly limited to the area that is affected by the rosacea. And in that case, the pathology is deemed to be different. It's thought to be different. The spots in that case are thought to be related to the rosacea pathology rather than the individual having rosacea pathology and then separately acne pathology, as indeed that example from before had. Now, I very evidently missed out the middle example here, which is what if you have an individual who has generalized facial rosacea and then they also have spots, but the spots are limited to their face and are only on the areas that are affected by the rosacea because the rosacea is affecting their entire face. How do you know if that individual has coexistent rosacea and acne or if that is papulopustular rosacea? Well, in that case, it's much less clear than in the two cases beforehand, and you can try and do, clever history taking and find out, does this individual ever get spots outside of the areas affected by the redness, i.e. do they get the occasional spot on their neck that isn't affected by the rosacea, in which case that will be pushing you towards coexistent acne and rosacea rather than papulopustular rosacea. In addition, you can be clever and look very closely at the spots, and if they have blackhead lesions, which are open comedones, that instantly means that they have coexistent acne and rosacea rather than papulopustular rosacea. Because in individuals with spots because of papulopustular rosacea, they never ever get open comedone lesions. They never get blackheads. That is something that you only get if you've got acne. So if they have blackheads, that instantly means that it's coexistent acne and rosacea rather than papulopustular rosacea. However, it doesn't work the other way around. If they don't have blackheads, that doesn't help you. It doesn't mean that it's papulopustular rosacea, because you can have acne without having open comedone lesions, without having blackheads. But if they do have blackheads, that will push you towards acne and rosacea rather than papulopustular rosacea. However, the thing that ultimately usually decides whether it's going to be coexistent acne and rosacea or papulopustular rosacea is usually the age of the patient. If you've got a 20-year-old who has a red face and spots, that is almost certainly coexistent acne and rosacea. Whereas if you have a 70-year-old who has a red face and spots, that is almost certainly papulopustular rosacea. In the middle, let's say we have a 45-year-old with a red face and spots, what you're going to need to find out is a little bit more of the history. Have they had spots since they were a teenager, in which case it's likely acne, and then they've developed redness later on, in which case they've got coexistent acne and rosacea, or instead is the history that they never had acne as a teenager, they never had a spot until they were 43, let's say, and then they started developing facial redness and then spots on top of that, in which case that is papulopustular rosacea. So it can be a little bit difficult distinguishing between coexistent acne and rosacea and papulopustular rosacea when you have an individual who has red face and spots. However, it doesn't to a huge extent matter that much, because the treatment for the spots in either case is the same. And I will just talk a little bit about the treatment for papulopustular rosacea and coexistent acne and rosacea. So the main treatments would be oral antibiotics, erythromycin, tetracycline, and then if those don't work, going up to oral isotretinoin, Roaccutane. Oral antibiotics, tetracycline or erythromycin, these will help not only get rid of the spots, but they can also actually be used to treat pure rosacea. So individuals who don't have spots and just have a red face, oral antibiotics can sometimes be effective at reducing the redness, and we don't really completely understand why yet. But they can be used, they can be prescribed by primary caregivers to help with pure rosacea. If you've got rosacea and spots, either because of coexistent acne and rosacea or because of papulopustular rosacea, then being given the oral antibiotics will hit both of the conditions. It will hit both the redness and it will help reduce the actual spots. Going up to oral isotretinoin is fantastic at getting rid of spots. However, the problem is that it usually will make the redness worse. So in either of the two conditions, if you've got coexistent rosacea and acne, oral isotretinoin will get rid of the acne, but it will usually make the rosacea worse. If you've got papulopustular rosacea, again, oral isotretinoin is fantastic at getting rid of the spots, but it will generally make the actual background redness associated with the papulopustular rosacea worse. Add on to that all the other side effects of systemic isotretinoin, and you can see that it's not ideal, but sometimes it is a necessary therapy. With that, I will end the video. Thank you for watching.